fresh air, a front row seat, and a chance to enjoy their favorite sport. The Texas summer sun is unforgiving, but the players don't mind. It is a chance to finally get some fresh air while they do their best at social distancing.
I actually do enjoy myself when I'm outside. Just being locked indoors for, what was it, like 3 months, 4 months. I mean, it drives you crazy, it drives you nuts for sure.
COVID-19 has also been driving Latinos to the hospital in large numbers in Texas. They make up about 40% of the state's population, but as much as 60% of the number of coronavirus cases here. In part, it's caused by their jobs. Many Latinos work in close quarters in construction, landscaping, or something else outside. There's also inadequate testing. And according to doctors, much more.
The Hispanic community has a lot of multi-generational homes.
An infectious disease physician, Richard Yates, has been consumed with COVID-19, an illness characterized by how easily it spreads when people are in close contact.
And so you're sort of stuck with a situation that you can't fix. You can try to enforce hand washing and mask wearing. That's hard to do in a home situation.
There is another side to the COVID-19 outbreak, affecting tens of thousands of people from Latin America trying to forge a legal path to citizenship. They are non-Mexicans who are now trapped along the Mexico-U.S. border in dangerous cities such as Ciudad Juarez and Matamoros. Refugees who have had their hearings in the United States scheduled over and over and over again.
People seeking political asylum from Cuba or Venezuela and fleeing gang violence from other countries end up in camps like this under Migrant Protection Protocols, or MPP. The Trump administration initiated the MPP program last September to keep asylum seekers out of the U.S. until their court cases were heard. But since the COVID-19 outbreak in March, hearings have been canceled. We'll call her Beatrice, a legal U.S. citizen who doesn't want her identity exposed for fear of government retribution. Her Cuban fiancé has been trapped in the border city of Matamoros under the MPP plan.
He's currently in Matamoros, and it's not just him. There are many people waiting for an interview and a court order, but it gets pushed back every month. This is a stressful and depressing situation, not just for them, but for their families as well. More than anything because of the situation they're living in.
COVID-19 gave Donald Trump the wall he promised. It has shut down legal immigration since roughly March.
Immigration attorney Fernanda DeBovi says the past 3 years have been a constant struggle under Trump's zero-tolerance policies.
One of the human tragedies that's for the immigrant community from COVID-19 have been the refugees that were trapped in Mexico when President Trump in last September began the Migrant Protection Protocol.
They're blaming the pandemic, but the economy has been opened, so they don't care about the pandemic. But they're using the pandemic as an excuse to not open up immigration courts.
Being stuck in limbo, at the mercy of Mexican gangs or corrupt law enforcement near the camps, DeBovi says people get desperate and do things they shouldn't, such as try to enter the U.S. illegally. If caught in the United States and deported, it means he or she must wait 10 years before applying for legal status. This all plays great for Trump's base, according to DeBovi, and he says whether by design or fate, Trump is getting something else.
How many people have their citizenship applications stuck who will not be able to vote in November because of the shutdown by COVID? Could that affect an election? It could, a close election.
It is just another way the pandemic has snaked its way into the lives of the most vulnerable. People stuck at the border, waiting for a better life, waiting for their day in court, and waiting for a day in the sun. Sean Caleb, CGTN, Dallas, Texas.